Yeah, so we need better biosensors, because rapid, affordable, and yet, highly accurate tests can really eliminate the delays getting the result from the diagnosis, such as from sample transport. And also it can enable the timely initiation of the most accurate and effective treatment. COVID-19 is a great example. If we have a rapid test, then we can almost immediately triage the patients or let the patient to resume his or her normal life. And also in the hospital settings, the sepsis, for example, if left untreated, the mortality from sepsis would increase 8% every hour. We really need a rapid test to better deal with these infectious diseases. So I envision that the next generation biosensors is like smartphone that we can always carry. So before we detect a disease, actually we are going to use these sensors to monitor our daily health. And that will provide the baseline of my health states. And if there's an abnormality, then it will trigger the alarm that you might want to see the doctor. So not really going into diagnosis, we really need to change our thinking of monitoring the daily health. That's my vision of the new biosensors. Big challenge in deploying the point of care diagnostic sensors is not necessarily the sensitivity of the technology that we have, but it's more coming from the sample processing. Depending on how you process the samples, you will get totally different result. And if you really want to deploy these sensors in resource-limited settings or at home settings, then the key requirement would be that the sample processing should be automatic. Minimize the hands-on times. Yes, so I think the first step is not necessarily collecting the data from the public domain, but let the individuals collect their own data and look at the data, and then they might share their data with their doctors. So you can start with a kind of small sphere and see whether there is efficacy of this kind of continuous monitoring. And then if this proves to be helpful, then we can move on to the bigger domain, which is sharing the data with public health agencies, and then they can set up the public policy. But of course, I think in that case, the data should be anonymized such that you can identify that specific person. Because there appeared in accounts of chemical research. So this is truly impressive compendium because in this special issue, the leaders can learn the cutting edge technologies that we have been developing to answer different questions in infectious disease, diagnosis, treatment monitoring, and also checking the rising of the antibiotic resistance. So the readers can be exposed to the broader scope of the work or the test that has to be done in the realm of the infectious disease. And also they can read about the new innovations, breakthroughs in that area. Highly recommend.